For our project, we wanted to explore differences in health practices and outcomes, and we did this by analyzing the various associations between lack of health insurance, regular health practices, health outcomes, and healthcare expenditures per state. The data is taken from the 500 Cities Project, which analyzes data from the CDC in order to provide estimates for chronic disease risk factors, health outcomes, and clinical preventive service use. Looking at health insurance, we performed simple linear regression between health practices and lack of insurance and found significant linear relationships for all practices except routine health checkups. Overall, we found that the higher the prevalence of uninsured, the lower the prevalence of proactive practices.
We also attempted to predict health outcomes from these health practices. We found that a model for cancer had the most predictive power and a model for high cholesterol had the least. This makes sense because most of the practices measured were some type of cancer screening. Also, high cholesterol is largely due to genetic factors, so it makes sense that a model based on health practices may not be the best way to predict its outcome.
Next, we looked at health expenditure per capita across regions in the United States. We found that on average, the western states spend the least and the northeast spends the most. These differences was also found to be statistically significant.
Lastly, we generated plots to illustrate the relationship between prevalence of health outcomes and lack of insurance, and health outcomes and health expenditure. Typically, the percent of uninsured is positively associated with disease, but this association is reversed when the disease is cancer. However, the relationship between health expenditure and disease does not change too much across disease. Overall, we found that the relationships between health insurance coverage, disease, and health practices is incredibly intricate, and we've only scratched the surface of these questions of interest.